Started here, they're all excited to be honest, all of them 5, so it's going to be really hard to decide the winner of the night. But, please, Veratrak, let us know what you guys propose. Big round of applause.
Well, we get the technical issues, so I'll introduce myself. So my name's Matt. I'm one of the co-founders of Veratrack, and Veratrak is a software solution for the pharmaceutical supply chain, improving collaboration and efficiency as companies move drugs from being raw ingredients through to delivery to patients. We can just scroll through. You can go low tech. Cool. So, thanks. Great. So, I imagine there's not many pharma supply chain experts in the room. We've got some blockchain experts, but I'll do my best to explain. Here we've got a pretty simplified model of the pharma supply chain at the top, where you've got your big pharma companies. They outsource manufacturing and packaging, and that gets sent over to a distributor, and then ends up at the pharmacy or the hospital, and eventually with the patient. And currently, these companies are working together in particularly insecure and inefficient methods. So we're looking at how these organisations handle documentation handovers between them. The pharma industry, as you can imagine, is very heavily regulated, and quality of medicines is of utmost importance. So that comes along with a lot of regulation and lots of documentation that needs to be shared between these parties as drugs move through the supply chain. This is currently being done over email if companies are good, over fax if they're not as good, and through the post if they're even further behind. That leads to obviously a lot of expense and inefficiencies, but also where you end up having confusion over versions when you're outsourcing manufacturing. It's actually the primary reason why you have drug recalls in Europe, is you end up having the wrong version of artwork, the leaflet text and the artwork on the boxes, and that's due to miscommunication between the supply chain partners. The other issue with using email is you don't have any auditability, and that's something that's really important with pharma. Obviously, when things go wrong, the consequences are huge for the companies involved and also the patients at the end of the day. So there's a huge regulatory burden on reporting on the auditability of these documentation processes as drugs move through the supply chain. With email, everything's scattered in many people's inboxes rather than having that audit trail on hand. So that diagram at the top, you can see half of, is really just illustrating the complexity of the supply chains for the pharma companies and their partners. So this is one pharma company. They'll have about 100 to 200 contract manufacturing providers who they're outsourcing manufacturing to, and they need to manage all of that communication. So we built Veratrack, again a relatively blurry explanation here, but you can see you can create custom workflows here for all the documentation processes as drugs move through the supply chain. You can invite on your supply chain partners. You can see the bottom left, all the different participants that you'd have with a given workflow, and then specify all the documents that you need, any approvals that you need doing. We've got an industry standard, industry regulated e-signature protocol that we use as well. We then those processes can then be carried out on the platform. Documents can be uploaded, shared, and approved. And as I was saying, the problem with email, you don't have that audit trail. Well, with our platform, you have that audit trail. You can see exactly what's happened, not just internally, but with your suppliers and your customers as well. So when something goes wrong, at the moment, you're self-reporting what's happened. You're going around collecting things from inboxes, you're emailing your suppliers. We're getting audited, we need to get all this information. When something's gone wrong, obviously you want to cover your ass, so you're sending through wrong versions of things. That's happening, and there's those fraudulent activities that are happening. With our platform, we take each of these audit log events, and we take a hash of that event. So if there's a document that's been uploaded, we take a hash of that document, add some metadata to that, hash that again. We then combine those into a Merkle tree every hour, and we save that on the blockchain. We're currently using Ethereum. We're going to be adding a couple of other public blockchains. What that means is, you just scroll up. 6 months down the line, there's been an issue with a particular drug batch. You're trying to say what's happened to a regulator. Well, you can say what's happened, but even better than that, you can prove that that's exactly what happened. You can go within Veratrak, you can locate that audit event, you can recreate that fingerprint, recreate that merkle tree, and then you can compare that with what's been stored immutably on the blockchain. So you can prove to the regulator that you didn't mess up. And that's obviously a huge issue that's being faced by the regulators at the moment. This questions over data integrity. The reason that we use merkle trees here is using public blockchains. Obviously, there's issues around scalability and transaction costs. So by combining many transactions together, we have a really well scalable application and also keep our costs down. I think there's been some great comments about building products that solve real business problems rather than just great tech solutions. So we took that really to heart, and we spent a long time talking with senior management at all the companies you see on the slide here before we embarked on building our products. And that's really paid dividends. We got some the top right. We got some great funding from CCAMP earlier in the year, and we've been part of the Oxford Foundry Accelerator program as well. But really excitingly, we just finalised our first 2-year contract with a pharmaceutical packaging organisation based out in the Netherlands, and we'll be going live with them in a couple of months. And that's live with real product rather than a proof of concept or pilot environment. You scroll down. Yeah, that's great. Another initiative we're launching is that the problem that we face is large corporates don't often like to work with startups, and they're kind of scared by this new tech. So we're launching a working group for the pharmaceutical industry, looking at how blockchain is going to shape the future of the pharma supply chain. We're bringing together supply chain executives from those pharma companies and across the pharma supply chain, along with blockchain leaders, standards agencies, and third-party innovation groups and consultancies, to examine where the pharma supply chain is going and how blockchain fits into that, both from our point of view, but there's also many other companies working in the space. We've got some other ideas about how blockchain and other innovative tech can really build that pharma supply chain of the future. Looking short term at the data that we can collect from our platform and building analytics tools to be able to drive further business insight from that. In addition to being able to track real time the location of drugs and the ownership of drugs as they move through the supply chain. I don't think the demo is going to work in this format, but we can skip to the next slide. Yeah, so we're really excited about Veratrak, and we hope you guys are too. We're doing some really cool stuff and launching with a real business problem, as I said, in a couple of months. So we're expanding the team at the moment. We're looking for quality assurance analysts as well as node developers. So if you're interested, we've got most of the team here today, so you can come and chat with us. We're a super talented team and looking to expand that. As I mentioned about Epoch briefly, we're launching this platform and working group for the industry, but we're also looking to get involved experts who've got ideas about how technology can impact that industry. So if there's anybody here that'd be interested in chatting more about that, then we'd love to chat about how you guys can get involved. And the other thing is we're currently closing a round of fundraising. We're still open to conversations with potential investors there. So if there's anybody else in the room, we've got most of the team here. We'd be more than willing to chat. Yeah, thanks a lot. Thanks a lot for the time today. I really appreciate the invitation to come on.
Thanks to the whole room here. This is